Genuinely, all I've ever wanted to do is be a doctor. And then I found heart failure in my medical training, and I knew that that was the right niche for me. And I can't imagine doing anything else. My name is Sanjana Bhatia-Patel, and I'm an advanced heart failure and transplant physician with Lankana Heart Group. I treat heart failure and end-stage heart disease, and that's really the focus of what I do, is to keep patients well when they have been diagnosed with heart failure. My clinical focus is on the pumping mechanics of somebody's heart and how the derangement or distortion of the pumping mechanics makes patients feel. The blood does not circulate as well as it should, and then patients end up symptomatic. So diagnosing that, finding out the reason as to why that is the case, that's something I spend a lot of time doing. We optimize the fluid, we optimize the blood pressure, and we talk about other changes that patients can make on a medication basis or on a lifestyle basis to get them breathing better and feeling better. But we have also made really significant advances, I think, in end-stage heart failure and keeping patients going when the medications fail. I think Mainline Health and Lankana Heart Group is considered a destination for patients with heart failure. We are all trained in managing advanced heart failure, in preventing the progression of heart failure to becoming end-stage disease. But then if it were to progress to becoming end-stage disease, we are situated to be able to act on that by starting IV medications that patients can go home with, by evaluating patients for left ventricular assist devices, and also considering patients who might be candidates for heart transplantation. Then we are poised to be able to refer them out to the other heart transplant centers that are in the area. The resources, I think, within the Lankana Heart Group are vast, and I think that it's a really big advantage for patients. We have different colleagues that have their niches in different areas of cardiology, and then if we have somebody who needs an operative intervention, then we can send them to our structural heart team, to our surgical team, to our interventional cardiology team. Heart failure is such an exciting field because it's relatively new. We have medications that are coming out very regularly, and we have device therapies that are coming out very regularly. And there's so much innovation and so much investment to really be able to cure this epidemic. I think that'll be a huge win for healthcare. The greatest satisfaction I get in this job is when I see somebody who initially was not feeling well, was quite ill, and they feel better. They can go for their jogs. They can go back to work, and they feel like they can think clearly and that they can function. I think there's no greater satisfaction than that.